Ahora.
Good afternoon, ladies and gentlemen. Today it gives me great pleasure to interview Dr Isabel Garau from Llatzer Hospital. Isabel, good afternoon.
Good afternoon, gentlemen.
Can you tell me a little bit about yourself, Isabel? A little bit about your history, your background?
Well, my name is Isabel Garau. I am medical oncologist at this moment, working at Llatzer Hospital, and I came into oncology 35 years ago. It was different time
sure.
than now. So I worked in different places from 1977. Then oncology was not a medical specialty, and we were working not as the classical system of formation we know at this moment. And then I worked for many years, for 20 years in the cancer registry, and for 10 of these years I was out of oncology.
Isabel, well, you said that when you started 1977, clinical oncology was not a speciality. And has there been, I suppose, enormous changes in those years? Can you tell me, for example, what do you think have been the most important changes for you?
Well, there is many changes, but probably the most important changes is
In the field.
In the field of cancer prevention, and also the directed cancer therapies, and also the multidisciplinary team to treat cancer. Adjuvant therapy was also a great important thing in these years.
So there's been so many changes, but you mentioned in your little introduction about your background, your history, you mentioned about the cancer registry. How was the cancer registry? How was the experience for you, Isabel? Did you enjoy it? Did you find it difficult? A little bit about.
Cancer registry it was started in 1982. It started as a monographic registry of colorectal cancer, but in 1989 it becomes a population-based cancer registry for all kinds of cancer. So it was an enormous challenge, because the system of registration was very different. They were not PCs, nor
informatic system.
And in our country, it was not a habit to declare, to notify,
to declare the cases of
cancer. So it was a vast
it was an enormous work.
Yes, enormous work. So that has also changed.
And for you, why is a cancer registry so important?
The cancer registry it remains to be important, because the only way to test really what the treatment we are giving to the patients is to know about the results of the treatment. So to monitor the incidence and the survival of patients, there is no other tool at this moment, and does make the registry important.
But for you, spending so long in the cancer registry, 10 years or 12 years, no? 12 years I think.
20 years.
20 years in the cancer registry. To come back into clinical oncology was difficult for you?
It was another challenge because, you
Changed, yes.
me question
Yes.
what advances in oncology on these years.
Yes.
When I started to work into the field of oncology, there were a little bit opportunities for many tumors. We had only, I think, 5 or 6 chemotherapy agents.
No.
The radiotherapy was not evolved. So when I come back to the oncology, I realized the change, and it was an enormous qualitative change. More therapeutic agents, more directed therapies,
tailored
therapies, and more to do in all the more surgical advances, and so it was very
challenging and very exciting.
Very exciting.
Very exciting.
So I was very happy to have the opportunity to come back to the clinical.
Fantastic. Fantastic. You are now a specialist or a subspecialist in breast cancer. What fascinates you about breast cancer? Why do you find it so interesting?
Breast cancer is very, very interesting because it's a kind of tumor very threatening in women, and for his characteristics is a very, it has the treatment and the prevention and has incorporated all the advances in oncology. We have assisted to screening breast cancer before the tumor is so evolved. We have the possibility to even to screening familiar mutation or genetic mutation to prevent better these cases. You have also very surgical advances.
Many surgical advances.
Many surgical advances because before it was the prescription, the surgery was
rudimentary.
Only mastectomy, the only possibility.
No, it's the only possibility.
No, we have evolved very much in this field, and also we can apply adjuvant and targeted therapies. That's very, very interesting, very.
No, it's a fascinating field of the breast cancer. No?
Yes.
I have a difficult question for you now. If you were training again to be a doctor and you were deciding which speciality you would like to go into, would you choose to be an oncologist again?
Oncologist, I'm very happy to have decided to work into clinical oncology. Very happy. I think I tried very well. Very well done.
It's a good choice.
It's a good choice, yes. But at this moment, I like very much all the questions,
the topics
about neurology, and probably I think the specialty for the future will be neurology.
Okay, fantastic. Okay, very, very interesting.
Yes.
Another question. I know that a couple of days ago or a week ago you were on a workshop talking about sex with patients with oncology.
Yes.
Can you give us some ideas about this topic?
Well, it's a heavy demand by the patients about this question more and more frequently. So one woman, one aged woman.
How old? So this is not okay. I'm not going to ask. Okay.
Sometimes think that we're not so prepared about this
topic.
So it was I contact with friend. A nurse is also a friend. She's she worked in oncology nursing, but she's also a sexologist. And we have the idea to prepare a workshop about this thing.
Okay.
It was a very
interesting,
exciting theme, and we were people was very
happy
to
come
can
to this
speak
workshop
about this theme, and well, I think we can
help them a lot, no?
Yes, because at this moment, with at least with women with breast cancer, we are concentrating therapies in an early phase of the illness, and then we try to send back to the society and to have they have to realize this.
To push forward, to go forward, or to
go forward,
yes, to go forward in their life, in their everyday life, no?
Yes,
okay.
And for the characteristics of breast cancer, because it's the highest incident tumor in
women,
in young women.
In young women.
So I think it's a very good project. Yes.
A very interesting project.
Yes.
I hear that you're a very fine excursionist. What do you enjoy about the excursions in Mallorca, Isabel?
I enjoy it. I have not many opportunities, and I am not a fine excursionist. I am very enthusiastic.
This is the...
But well, I enjoy the exercise. I enjoy the friends and also the fantastic landscape. Yes.
The word you just used there, enthusiastic, maybe is how you treat everything in your life with enthusiasm. Would you say that enthusiasm would be a word which goes well with Dr. Garau?
Yes, I am enthusiastic and sometimes excessive. Yes.
Well, today
I know.
it's been a great pleasure speaking to you, Isabel, and thank you very much.